When we picture modern medicine, a specific hierarchy usually comes to mind. The doctor is the brilliant architect of care, and the nurse is there to hand over the tools and execute the orders. But this map shows the distribution of medical staff worldwide. Notice those towering columns? Those represent nurses. Globally, they constitute the absolute largest group of healthcare professionals, vastly outnumbering every other role in the hospital. This recognized profession was formalized in the 19th century, largely spearheaded by Florence Nightingale. Today, the role has transitioned into an independent practice, requiring mastery of complex pharmacology, advanced diagnostic tech, and acute clinical judgment. Because nurses represent the vast majority of face-to-face patient interactions, they are the primary point of delivery for the entire system. Their ability to catch a shifting symptom or manage a complication is the baseline that determines whether a patient recovers or declines. Right now, that baseline is under extreme strain. Hospitals around the world face severe workforce shortages, unmanageable patient-to-nurse ratios, and a noticeable lack of nurses in the boardrooms where policy decisions are made. When you stretch a staff this thin, the mechanical result is chronic burnout. As focus fractures, clinical errors increase, and specialized units are eventually forced to shut down because they can no longer meet safe staffing requirements. The 2026 International Nurses Day theme focuses on a specific solution: empowered nurses save lives. This is a calculated, evidence-based strategy designed to repair this exact systemic crisis. What does it actually mean to mechanically empower a healthcare worker? And how does that process directly translate into saving patients? This blueprint maps out empowerment as a structural upgrade to the healthcare machine. It relies on three specific pillars: education, advocacy, and workplace support. The first node, education, requires accessible pathways for continuous professional development. By earning advanced degrees and specialized skills, nurses become clinical experts capable of managing high-stakes medical scenarios independently. The second node is advocacy. Because nurses are positioned right at the bedside, they collect the most accurate frontline data. When they have a voice in policy, that information flows to administrators, allowing institutions to identify and fix safety risks before they reach a patient. The final node is workplace support. This is the foundational requirement of fair compensation, physically safe working environments, and robust mentorship programs to keep experienced talent in the field. When a hospital system successfully installs all three of these pillars, it transforms its largest workforce into a proactive driver of safety and innovation. We have empirical proof of what happens when nurses shift out of supportive roles and step into leadership positions. In Kerala, India, Sister Anjali recognized critical public health gaps. During the pandemic, she designed and spearheaded a comprehensive community health and vaccination initiative, ensuring vulnerable populations received timely intervention. At a major hospital in Dublin, Nurse Priya took command of a multidisciplinary medical team. She directed a massive overhaul of the facility's infection control measures, pushing for strictly evidence-based protocols. This graph illustrates the hard metric of her success. After implementing the new protocol she designed, hospital-wide infection rates plummeted. In the United States, a nurse named Amanda analyzed a severe lack of medical access in remote Virginia villages. She secured resources, designed, and launched a dedicated mobile health clinic to deliver essential services. By bringing maternal and child health support straight to the patients, her mobile clinic reduced infant mortality rates and stabilized the health of those communities. In all three of these examples, the nurses acted as true public health architects. They identified systemic flaws, engineered complex solutions, and executed those plans to protect their patients. The modern nursing profession operates as a network of independent practitioners, researchers, and educators. In developing nations, they are the sole bridge connecting remote populations to quality medical access. When you look back at the crowded, archaic wards of early medical history, the immense scale of how far the profession has advanced is obvious. Yet significant barriers remain. Nurses continue to face workplace discrimination, severe underfunding for specialized education, and a glaring lack of representation in high-level leadership. If we fail to invest in their education and equip them with modern technological tools, we erode the reliability of the global healthcare networks. Providing the resources and authority for nurses to lead is a strict systemic requirement to build resilient healthcare systems capable of